Radiation therapy. Androgen deprivation therapy in men with prostate cancer, sexual dysfunction, penile rehabilitation. Today, I will talk about radiation and androgen deprivation therapy in men with prostate cancer and their impact on sexual function. I believe there are several key points that you should be aware of. Radiation therapy for prostate cancer can affect sexual function in several ways, both in the short term and long term. It is very important to know that radiation therapy for prostate cancer can affect sexual function, primarily through erectile dysfunction, which may develop gradually and worsen over time. Other potential issues include decreased libido, changes in orgasm intensity, and reduced ejaculate volume. Here's how it typically impacts men. Erectile dysfunction, or ED. This is the most common effect. Many men experience some degree of ED after radiation therapy. Why it happens? This is due to damage to nerves and blood vessels involved in erection, especially over time, reducing the blood flow to the penis due to radiation's impact on vascular structures or deterioration of the erectile tissue in the penis. Timeline. ED may not happen immediately, but can gradually worsen over 1 to 2 years post-treatment. There is a gradual onset. Unlike surgery, where ED is often immediate, radiation-induced ED tends to develop slowly, potentially taking 2 to 3 years after treatment. Severity varies. The severity of ED can vary, with some men experiencing mild to moderate difficulties, while others may have more significant problems. Changes in libido, fatigue, emotional stress, and hormonal changes, especially if combined with hormone therapy, can reduce sexual desire. Hormone changes due to radiation or other treatments can lower sex drive. Hormone therapy, often used with radiation in more aggressive cases, lowers testosterone levels, which significantly reduces libido. Dry or reduced ejaculation. Radiation can damage the seminal vesicles and the ejaculatory ducts in the prostate, reducing or eliminating ejaculation. This is often referred to as a dry orgasm. In my experience, most of the patients after radiation therapy have damage to the ejaculatory ducts resulting in a dry orgasm. Changes in orgasm. Orgasms may feel less intense or different. The orgasm may still be pleasurable, but with no or very little semen. Some men report discomfort during orgasm or changes in how long the sensation lasts. Penile shrinkage. Some men notice a shortening of the penis, which may be linked to reduced blood flow, scar tissue, or radiation damage. Psychological impact. Anxiety, depression, or concerns about masculinity and intimacy can also affect sexual function. Hormone therapy for prostate cancer, also called androgen deprivation therapy, or ADT, reduces levels of testosterone. While it's often effective at slowing cancer progression, it can have significant effects on sexual function. Here's a breakdown of how and why. Decreased libido or sex drive. Testosterone plays a crucial role in maintaining sexual desire. Lower levels of testosterone often correlate with a reduced interest in sexual activity, which can begin within weeks of starting therapy. Erectile dysfunction, ED. Even if libido remains intact, many men undergoing androgen deprivation therapy find it increasingly difficult to achieve and maintain erections. Erections depend on testosterone, as well as proper blood flow and nerve function, all of which can be influenced by age or other health issues. Most men may stop experiencing spontaneous or nighttime erections. Additionally, for many patients, medications like Viagra or Cialis may not be effective in generating an erection, as these treatments require testosterone to work. Reduced ejaculate volume. Semen production depends on testosterone levels, and it could be decreased or stopped entirely. Orgasms may still occur, but are often dry. No semen or fluid is coming out. Changes in orgasm. Orgasms may become less intense or pleasurable. To reach orgasm, testosterone is critical. So many patients can report difficulties to reach climax when they are on androgen deprivation therapy. Some men report a complete loss of orgasmic sensation. Emotional and psychological changes, like depression or anxiety, may also affect this. Infertility. ADT can lead to temporary or permanent infertility, and so can RT. If fertility is a concern before treatment starts, the best step is to bank sperm. Emotional and psychological effects. Depression, anxiety, or body image issues due to weight gain or breast enlargement can indirectly lower sexual interest or satisfaction. Relationship stress due to changes in intimacy may also arise. Radiation therapy and androgen deprivation therapy can impact sexual function. However, many men continue to enjoy an active sex life during and after treatment with the right support and management. Open communication with partners, appropriate treatment assistance, and counseling can help address these concerns effectively. You're not alone. The proper treatment and support will help you maximize your recovery of your sexual life after cancer treatments, especially during and after radiation therapy or hormone therapy. Don't forget to share this information. Give me a like if you think it's useful, and subscribe to my channel for more updates. See you in my next video.